You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. According to my first guest, no more dentures. Get a fixed set of teeth in just a few appointments. With us, we have Dr. Kelly Olsen. Dr. Olsen, welcome to the program.
Thanks, Randy.
Now, before we get into today's topic, and I know you brought photos, who's the typical patient and what are the different procedures specifically that you do every day?
Yeah, the typical patient would be anybody. Families. We start with children all the way to people that are in their hundreds.
Is that right?
Believe
You've
it or
had
not.
somebody over 100 years old?
I have. It's fun. The children, I do a lot of sedation dentistry in my office. I do IV sedation, and I do that with children as well.
And you're doing the sedation, is that right?
That's correct.
Less than about 5% of dentists in the U.S. are doing that. So special license for IV sedation.
As far as general dentists, that's correct.
Yeah.
That's correct.
Okay. Dental implants, big part of your practice.
Dental implants are. Over 50% of my practice is surgery because of people needing those things, whether it's bone grafting, dental implants, taking teeth out and replacing implants, dentures, people that have dentures, they can't function properly, so we're helping them be able to function, eat corn on the cob, eat apples, eat things that they haven't been able to eat for decades.
And also you're known, or you like to be known as Dr. Painless, right?
That's correct.
Even your license plate says what?
It says Painless with one S. You can only put 7 letters.
Okay. Were you surprised that was available when you got that?
I was. I didn't expect it to be available, but it was.
And your website's Dr. Painless as well?
drpainless.com.
Why
drpainless.com. Well, I want people to know that they don't have to have pain when they see the dentist.
Okay. And, you know, for people tuning in, we're talking about no more dentures, get a fixed set of teeth in just a few appointments. We're talking about dental implants, but I still want to talk a little bit about your practice. I mean, big on lasers.
Yes.
You're using lasers to do just about everything.
Right. I use lasers for cavity preparations. I haven't numbed up a child in about 8 years for a typical cavity for a child's tooth because of the laser. And kids don't know any different. They know that there's a popping sound and it might be a little cold feeling, but a little 3-year-old sits there and they jump up out of the chair and they're not numb, and their mom is just stunned because her mom is picturing this experience when she was a child, and now this child's not even getting numb. The laser.
And you have a laser detection for cavities too?
The laser detects cavities. We have cavity detection software. We have lasers that scan teeth to make crowns the same day, so they don't have to wait for the lab.
You have a machine in your office that does it.
A machine that does it, so they don't have to wait 2 to 3 weeks to get a crown back. The laser that disinfects root canals. I have a laser that'll do root canals. The lasers do so many things today. I love working with lasers.
I mean, you do, you know, I'm not trying to endorse you here. You know, I'm just asking the questions, but I mean, this under one roof philosophy, as a convenience to the patient.
Oh, yes, yes. I do a lot of continuing education. You have to if you're going to do a lot of different things so that you can provide the level of care that they need.
So you do extractions and you do those things, because a lot of people don't know this, and we've talked on the phone, that you go to one guy for the surgery, for dental implants, another person that puts the crown on top of the implant, and you may go somewhere else for this or that, and so under one roof. Do you think that gives you an advantage? I mean, as far as patient care or better results?
I think it does for me. The typical approach is the team approach, as you described, where you go to different people to get those things done. And I've had several patients that come to me because of the fact I can place the implant, take out a tooth if it needs to be done, do whatever grafting procedures, and do their final restorations, whether it's dentures or crowns. And so I get to control that. I get to put the implants where I want to put them, so I know that that patient's going to get the best result that they have.
So tell me this, going into dental implants, why is it what used to take maybe 9 months or so for dental implants now can happen in a visit or two, in an ideal situation?
Yeah, before people didn't know. There was a lot of research. They would do implants and they thought they had to wait. You don't have to do that anymore. I had a lady come in that we talked about what could be done, and 4 hours later, she had a full set of teeth, all placed the same day.
Same day?
Same day. She had the bone structure that supported the implants. She left with a full set of teeth. She was amazed.
So that's possible. I mean, when you hear things like teeth in a day or dental implants in a day, I mean, that's possible.
Absolutely.
Right? Very interesting.
Happens on a regular basis.
And imaging, I guess you say, has changed things.
Right. Imaging has made it so that it takes the guesswork out of dentistry. You get an image that shows you a 3-dimensional image of the patient's jaw and their nerves and their bony structures, so there's no guesswork anymore.
So what are the different categories of dental implant patients that you see?
Yeah, you get the single tooth implant patient. He comes in, has to wear a flipper you take in and out, or bridge. People don't want that. So
Okay.
one implant, it's like your normal tooth. You can do 2 or 3 implants and replace a section of the teeth. And the next implant patient would be one that gets their whole mouth restored.
All right.
And that can be with full crowns, or it can be with dentures, whatever they're choosing. The next category is the people that have been told their teeth have to go. They have no choice, they've got to do something. A lot of these people, they don't do anything. They don't know there's another option. They don't want to wear dentures.
Okay.
They don't know about implants. And so when these teeth have to go, what do? They have dentures that flop around, or they get implants so they're solid. They can eat whatever they want. They can eat apples, they can eat corn on the cob.
And what about what are the age ranges of the denture wearers that you see for dental implants?
The youngest I've seen has actually been a teenager,
Okay.
all the way up into their 90s. I have this patient, this lady, 73 years old. She has a denture, flopping around, moving around, and we place implants. So now she's got a fixed set of teeth, same denture. So she leaves that day, now
Really?
having
Okay.
fixed set of teeth. Now she can eat anything she wants. She can eat apples, she can eat salads, she can cut through things that she hasn't been able to do for decades. So now she has this fixed set of teeth. She drags her husband in, who's 20 years older, so he's 93.
Okay.
Okay, and he's skeptical. He's not sure. He listens. He believes her enough. So we do the same procedure on him because he has dentures that are moving around.
93 years old.
93 years
Okay.
old. So we place the same implants for him. So now he has a fixed set of teeth. We put those in. He comes in for his follow-up a week later,
All right.
and he looks at me amazed and says, I should have done this 20 years ago. Amazed at what a difference it changed in his life. This man is 93 years old, and he has the excitement of a 73-year-old.
So at 93, though, that's not too old to do it. I mean, they'll stay in the bone.
Right, they will. 93-year-old.
Pain, though, because it sounds very painful.
It sounds like it could be, but this guy, we didn't have to make an incision. We didn't have to do anything real aggressive. And so when he was finished, the next day he said, I can't believe I'm not having any pain with this procedure.
Is that common, though, by the way?
It's common.
Do you hear that?
It's common.
Because
It's
you
very
use
common.
terms like it's virtually painless to get dental implants.
Right.
Is that right?
Right, it is virtually painless. In fact, during that procedure, people are numb. They're not going to remember that. Afterwards, a lot of people are worried that afterwards they're going to have a lot of pain. There's about 5% of the people that may have more pain, but 95% of the population are going to walk away, and the typical comment I hear is, this isn't nearly as bad as I expected.
Now, the 93-year-old guy and these people, everybody, 70 is young today,
Right.
are told to eat more fiber and eat things like this. So denture wearers are not really chewing these foods. They're kind of mushing it around. I mean, help me understand that part.
Well, they eat what they can.
Because I know denture wearers and they don't complain about these things.
Well, they learn to tolerate their teeth.
Okay.
They don't walk around complaining all the time unless it's another denture wearer, but they learn to tolerate them. So, or they don't eat they eat what they can.
Okay.
When you give them implants and you have a fixed set of teeth, it opens up a whole new world of what they can function and chew with, and they didn't know existed.
Why is it? I mean, if these implants, dental implants, especially for denture wearers, and you say with just 2 implants, you could give them a full arch of teeth that snap in and snap out. Is that right?
That's right. With 2 you can. Problem with 2 is they are going to have a little movement. You put in 4, now they're solid. So I always recommend at least 4 to do that, but 2 will stop them from moving. So we like to put in at least 4. When you've got at least
So 4 implants and you get a full arch of teeth on the lower.
full arch teeth and lower, and you can actually screw the denture in if they have a denture, so it never comes out. Now they've got a fixed set of teeth. It's a whole
But if
different
it's
world.
as good as you say it is, okay, would you say there's thousands of people in Utah that have either an upper or lower denture?
A lot more than that.
Tens of thousands.
Tens of thousands.
If it's as good as you say it is, why isn't everybody doing it? What's your take on that?
I think the biggest reason is the fact, in my opinion, they don't know. People don't know their options. They've been told they're not a candidate. What I found is if they can walk into my office, they usually can get dental implants.
Okay.
There may have to be some other work done, but they can do that. They don't know the options. They don't know the different types of implants. They don't understand that.
Because they don't go to the dentist anymore.
Well, right. They don't go to they haven't been told. A lot of them haven't seen a dentist for 10, 20 years. A lot of them think implants are too expensive. They're not as expensive as some people would think.
Because they count their teeth.
They count their teeth.
And you only need like 4.
They've heard from somebody 4. There's different implants now. You can have different types of implants and the cost can drastically change.
Okay.
And some people are actually surprised, wow, I didn't know that it could be that affordable.
Is that right? So you present the treatment and they say, that's it?
Oh, some do.
Okay,
Some do.
okay.
But we can modify options. People need to know their options. They don't know there's options. They think there's one cost and they're too expensive for them and they're all on a fixed income, and I understand that. I mean, my dad, he's on a fixed income. He's retired. And so...
I told you my mother, 74 years old. She said, after talking to you guys, dentists over the years, and I told her about, she's a denture wearer. She said, Randy, impossible. My medical doctor said I'm too old for dental implants. Is there that perception out there, do you think?
Of course there's that perception. People think that all the time. That's a regular perception. And people say that all the time in my office. I'm too old. And we start talking about, well, wait a minute, you're 73. Look at your medical history. You're very healthy. The average age now for a female is about 87. You've got at least 14, 15 years of how are you going to function.
Okay.
So there's a lot.
And at 70 and 80 years old, your life revolves around, functions. Eating, hanging out. I mean, if you're lucky enough to retire, right?
Right.
You said if there's a try-in period, Randy, if there was a try-in period for denture wearers, even with just 2 implants, snap in, snap out, like over the weekend, nobody could go back.
Right.
To their old loose-fitting denture. You believe that, though?
No, I do. I do believe that. These cases, I ask people, when we're finished, with their finished, fixed set of teeth, now that you've got these, if I could take them back, I'll give you all your money back. But you can't change it.
Patients?
Yeah, oh yeah, I say this. I say, I'll give you all your money back, plus I'll double it. But I'm going to take your teeth back, and you can't have any other teeth. You got to be stuck with what you had before. Would you do it? And people say, no. I'd pay triple for what I've got.
Is that
because
right?
it has so much value to them. Now they can function, and now they smile, because we do this most of the time so they can function well. But on top of that...
When you say function, you mean like eating,
right, so they can eat what they want. Okay. They can chew, they don't flop around, they don't move. And then once they do that, obviously when we're going to make them new teeth, we're going to make them look beautiful as well. So as a byproduct, they get these beautiful teeth.
Because you told me over there, you said, Randy, this is more than dental implant. This is about having a great smile.
Right.
How important is this smile in your opinion?
It changes their life. It doesn't change the person completely, it just takes that person that's in there and brings them out. Okay. And when it brings that person out, you see who was there. So this person, for example, there's going to be a judgment placed on what type of life this person's had, what he's got going on in his life.
Okay.
But there's going to be an after here that you're going to see a drastic change in this individual.
Now, is that unusual, by the way, to see a guy like this come in?
You would think it would be. This is very common. I see this all the time. People come in and of course they all say the same thing. This is the worst you've ever seen.
But I never see this. I mean, you don't see this like this.
The reason you don't see it is because they don't smile. They don't show you their teeth.
Good point.
And if they do smile, it's usually like this. And they're smiling under there, but they don't want anybody to see because they're embarrassed. They feel bad about it.
So when he comes in, this guy in particular comes in, what does he say?
Well, first of all, he doesn't say a whole lot because he's embarrassed about it. He doesn't want me to look, even though I'm the dentist.
Is that right?
And so he wants to know what he can do. He doesn't want dentures that come in and out. He couldn't eat. He couldn't chew. He didn't smile. His whole life, as far as any function, was non-existent. We gave him a fixed set of teeth on the upper and the lower. He didn't want something that came in and out.
Okay.
He wanted something that stayed in there permanently.
What if the gums are bad, though?
If the gums are bad, once you get all the bad teeth out and all the infection, they're going to heal.
Okay.
They're going to be healthy again. And then you're going to be able to give them those teeth.
Let's take a look at his after.
So, are you ready?
Okay.
Are you sure?
Yeah, I think I'm ready.
Okay. Now remember, this beard, you need to know that this beard, he kept that beard because he didn't want anybody to see his teeth. It helped hide his teeth.
Okay.
Okay? Here's his after.
Wow.
Okay, yeah. Now look at this. This is, if you notice the before, didn't want to smile, had a hard time. His after...
It doesn't look like the same guy, by the way.
No, it doesn't. He shaved. Now he's okay showing his teeth. He still has a hard time smiling, but he's getting there. You can see he's getting there, but now he's lighting up. He's showing things.
This is interesting. I mean, this is an extreme makeover. In a
Oh,
way.
it really is.
So when he looks in the mirror, what does he say?
He's astonished. All he can say is how appreciative he is, how thankful he is.
Okay.
To have these teeth now, that he doesn't have to be embarrassed, that he doesn't have to worry about what he can eat.
Is it more women, by the way, than men coming in for this? Because men tend to wait, I guess, to the last minute, till they can't eat, probably.
Yeah.
To come in and do something.
Usually it is more women.
Or is it? Oh, it is. Okay.
It's usually more women, but they're the ones that get the men to come in.
Okay.
And then the numbers start to change a little bit. But the women come in, and then the men, they'll bring the men in with them. So we see both. The pictures, you're going to see both.
Well, that's definitely a nice situation. I mean, that guy now. I mean, if you saw both of these guys on a job interview or walking down the street, completely different situation.
Right. Yeah.
Because I always think
It's
you're
obvious who you'd
exaggerating
hire.
when people come on my program, medical doctors, and say we're changing people's lives. But this is pretty obvious here.
Right. This is a case. It's true. This is real life.
Okay. So what else do we have here?
This one, I love this case because this is my dad.
All right.
So this is my dad. He's the average Joe. He's just a good old boy, and what you see is what you get. 17 years it took for him to come in because he was so petrified.
You had to talk him into it.
Well, even to have his son do it. I kept talking, but finally he couldn't function. He was dealing with the same thing that everybody else out there in his situation is dealing with. They don't know, they're embarrassed, they don't want anybody to see. They're dealing
When
with...
you say he couldn't function, what do you mean?
He couldn't eat the things he wanted to eat.
Okay.
He couldn't eat a lot of the foods that we'd think would eat well.
All right. And when you look at him on that before, so you decide you finally talk him into it.
Right.
So what do you do for him?
Well, I didn't have to talk him into it. He couldn't eat.
Okay.
So that's why he finally came in.
Okay, all right.
The fact that he couldn't function outweighed his fear of coming in. Even though it was his son, it's still the dentist. So he comes in, and we give him a full set of teeth, fixed teeth, and
discount. Did he get a discount because he's your father?
Well, of course he did. Of course he did.
All right. So what did you? So you gave him a fixed set of teeth on the upper and the lower.
Right.
Let's take a look.
Exactly. And this was the next day. Now we did the surgery, and then we had the teeth made because he lives out of town. I have a lot of patients that travel, and I have a lab that works with me, so we can get a lot of things done in a matter of days, so they can come in and get it taken care of. So this is his after.
Wow.
And the amazing thing was these were fixed when he left my office 3 days later. So Randy, now look at this. Look at this before. How he looks. He's not quite smiling as well.
Looks like a nice guy, but yeah.
He looks tired.
Looks older
He does. There's no question he looks a lot older. Now you look at his after, and look at his face. How he lights up. He brightens up. And he's excited now. You look at the smile and how it's a full smile, and the teeth are longer, about down to his lip, and his face doesn't look collapsed.
So your dad sees it for the first time?
My dad sees it for the first time.
What does he say?
My dad is literally in tears. And we took a picture together. And sorry, I'm getting a little emotional about it. Yeah, because it was an amazing experience to see the difference it made in his life that I knew. I had this envisioned in my head a long time ago.
Where patients get choked up. It's not just your dad. I mean, a lot of people get choked up when they see the final.
They do. It's an emotional experience to have this kind of change they've been hiding for so long behind their teeth.
How soon can your dad eat, by the way? Okay, so you gave him these beautiful teeth.
As soon as we went home, we went and ate, and he was excited. He could eat whatever he wanted that day.
Is that right? So now over time, I guess you got to be afraid a little bit to eat a steak. You know, that first time you eat what?
Yeah, as a matter of fact, he was excited to eat corn on the cob.
Okay.
Because he hadn't been able to eat corn on the cob. So we went out to dinner, he got some corn on the cob, and then he proceeded to eat whatever he could find. Okay. He was excited to be able to eat like he finally had teeth, because he hadn't done it for so long.
What about pain with him?
My dad was the typical case we talked about earlier. That night, now of course this is a patient.
So he goes in, and 3 days later he has these teeth. Did I hear that correctly?
That's correct.
And that's possible for a lot of people.
Right.
Okay.
It is.
Okay.
It is. And with my dad, he's staying with me. So he doesn't go home, and I don't hear anything, and I don't get to hear the ohs and the ahs and the things that you don't have to hear normally. But that night, We sedated him. He was relaxed. He loved the fact that he was sedated because he's a dental phobe. He's right up there in the top categories of being scared to death. He was amazed at how comfortable it was. He was amazed at how he didn't remember anything. And the biggest thing he was amazed about is he sat there and shook his head. I can't believe I'm not having any pain. I'm not having any pain now. I just had all my teeth taken out.
Does he become like an ambassador where he's telling all of his buddies with dentures, you got to go in there and do this?
Oh, of course.
Does that happen with patients?
Oh, when they find out and they have such an experience that's so life-changing for them. Yes, I mean, I just had a lady that I did about 15 years ago, and she just passed away of cancer. But during that 15-year time, she was my best ambassador there was. She would go to people's houses and show them her teeth. She was so excited about her teeth. She would literally they would call her, she would literally drive to their house and open up her mouth and show them her teeth because she was so excited to have the function that she had and the beautiful teeth. People commenting about her smile that she had never seen before. This is fun. You can see me getting excited about
this.
You're
into this.
This is
fun. Why do you like it
fun.
so much, by the way?
Well, because you're changing their lives. You're doing something that people don't know about. They don't know there's options.
Surprised sometimes? That means you give them a fixed set of teeth. Are you even surprised about what a big deal it is to them?
Yeah, I am sometimes. Some people, you just don't know if it's going to change. And you don't know. People are so different. That's what makes the job so fun. It's unpredictable. People are unpredictable.
Is this the happiest group of patients in all dentistry? Of all the different type of patients you see? The most thankful? The denture wearer that comes in and...
Or someone that gets a full set of teeth, not just a denture.
I'm talking about the denture wearers that come in and get a
right.
Is
exactly.
that the happiest group of patients?
They are. They're the happiest group. Anybody that gets a full set of fixed teeth is going to be the happiest. The people that allow me to do what I can do, and I can fix all their teeth and change their bite and change their function, they're the happiest. When you have to do compromises, they're not quite as happy.
Okay.
But when they say, hey, and some people can't do that, but those that can, there's no question they're the happiest.
And by the way, if you're just tuning in, we're talking about no more dentures. Get a fixed set of teeth in just a few appointments. We have Dr. Painless. His license plate, if you see him around town, is that right? It says Painless.
That's right. It says Painless.
Only one S, right?
That's right, only one S.
And you give the best injections, in your opinion. But you seriously believe this, where they don't feel it.
I do.
That's
right.
Okay,
That's
good.
right. I do. When they tell me, when they're asking me if they're going to get the injection and they've already gotten it, we know we've done a good job. I know that I have done it the way it should be done.
So no more dentures.
No more dentures.
I mean, and there's tens of thousands of people in Utah that don't know their options.
Right, there are. I have people that actually travel from out of state, siblings and relatives that say, hey, this happened for me, and they can fly in because of the fact that we do IV sedation. I can do a lot of things in one visit and get them finished right away. They travel in, get their work done, and then they travel back out of state.
This is great stuff, by the way. And we are out of time.
Let me just show you a couple more, Randy.
Okay.
A couple of these.
Two more.
Okay, two more. We'll show you two more. This lady here, she was told, she went to 3 different places and said she was not a candidate for dental implants.
Okay.
So we discussed this.
What'd she have going on, by the way?
Well, she only had 5 teeth on the lower, and she was wearing a partial she hated. And she said she wouldn't wear it. Okay. And she couldn't eat, she couldn't chew, it was moving around. She hated it.
All right.
And she wouldn't use it. She said, I can't use it. And so she couldn't use it. She couldn't eat. So what we did was I said, look, I'm willing to try this if you are, in spite of the fact there's some compromises here.
Because 3 other dentists told the same woman you couldn't do it.
3 other specialists had
so
said she couldn't do it.
So you did it. What'd you do for her?
So we placed 13 dental implants in different positions so she didn't have to have dentures and she could have crowns on her teeth. And after we were finished, another one of these.
How long did this take, by the way?
We did it all that day. It took about 4 hours with IV sedation.
So she comes in not even knowing that this is going to happen yet.
Right, not even knowing that right then. She wanted to start right then.
Okay.
So we started right then, believe it or not.
All right.
And it was exciting because when we were finished, this is what she looked like. This is
very nice. Wow.
Now look at the before here. Mm-hmm. This is an older smile. If you know her, she's vibrant. She's a fun lady. She loves to laugh. This is not her.
Okay.
So you look at the after now.
Okay.
That's
it's a
her.
pretty smile, by the way.
That is her. She
those are dental implants?
There's dental implants, right.
Okay.
Those are dental implants. And she is excited now. She doesn't have to have something that comes in and out. She can chew and eat and do all the things that she wants.
Do they send you cards sometimes?
Oh, yes. I get cards all the time, and they're fun to get, and we appreciate that so much.
Because you don't get that probably from the people that are getting fillings or root canals or whatever,
Sometimes
right?
we do.
Oh, you
Sometimes
do?
we do. We build a relationship with our patients.
And you say you have a friendly staff. I chuckle when I hear that because everybody that comes to my show says, I've got a friendly staff. But you convinced me, actually, in the green room that you actually have...
I do.
You said they like what they're doing, you have fun at work.
I have a great staff, and I hear that commonly from our patients. Wow, your staff is amazing. And I truly believe that.
Now, also, you're open on Fridays.
That's correct.
Most guys are closed on Fridays.
Most guys are closed. I choose to be closed on Tuesday.
Okay.
I like being open on Fridays because a lot of people can't find a dentist on Fridays. So most Fridays...
A lot of emergencies, things like that.
Right. I can take care of emergencies and do that kind of thing. So, yeah, Fridays is pretty important.
Okay. Now, we're out of time, by the way. Final message. Denture wear is watching this, right? They're afraid of pain. Maybe they think they're too old, like you mentioned. What's your message to them? They don't know their options.
The biggest message would be to come in, to get an opinion, to get your options. Find out what can be done, because with technology today versus even 5 years ago, there's so many more options now. Find out what you can do so you can live and eat and chew and smile and not have to be embarrassed and not have to worry about that.
And some denture wearers that are watching this could be candidates to where they walk in and they leave with a fixed set of teeth. Is that true?
That's true. I would say that most, by far the majority watching this, are going to be candidates, barring uncontrolled diabetes, cancer, those kind of things. But by far the majority are going to be candidates, and there's a good chance they can come in and walk out with.
No more dentures done right there, all under the same roof. Good for you. Congratulations, by the way.
Thank you.
And all of these photos are on your website? They can take a look at that?
They are.
At drpainless.com. Love that. Okay, good. Thanks again. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can visit our website at wellnesshour.com and just put in the Dr. Olsen's name. Also, if you'd like to make a comment about Dr. Olsen, do on Twitter, just put hashtag The Wellness Hour and say something nice about him. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.